Did you know that stroke is the fifth leading cause of death in America and the number one cause of adult disability? 80% of strokes are preventable. Yes, you can prevent a stroke. A stroke or brain attack occurs when a blood clot blocks an artery or a blood vessel breaks, interrupting blood flow to an area of the brain. Hello and welcome to Healthy Connections. I'm Annetta Wilson, your host. Healthy Connections is a show dedicated to exploring a wide variety of topics, from prenatal care to Alzheimer's disease. And we do so with a wide variety of perspectives, from the professionals that help treat the syndromes to everyday people like you and me who may have personal experience dealing with these topics on a first-hand basis. Stay tuned for a very special Healthy Connections. We're joined by Dr. Christian Rosado, a neurologist at Orlando Health Neuroscience Institute. Dr. Rosado specializes in the prevention, diagnosis, and treatment of neurological disorders. And he's here to shed some light on a topic that affects millions of people each year, stroke. Thanks for joining us, Dr. Rosado.
It's my pleasure. Thank you for having me.
Let's start with what a neurologist does.
That's a great question. So a neurologist is a type of doctor. Just like any doctor that goes to medical school, they go to college, they go to medical school, and they learn all the aspects of being a doctor. And a neurologist is a specialization. Once someone becomes a doctor, they do further training, they gather further experience, specifically in disorders and conditions of the nervous system, which the nervous system includes the brain, which is in our heads, our spinal cord, which is running down from connecting our heads to the rest of our body, and then all of the nerves that go all out throughout the body.
So everything that makes us feel, sense, all of that.
That's
correct.
Correct.
Your area of expertise.
That's what neurologists do.
So let's talk about when it goes haywire, a stroke. We kind of know what it is, but how do you define it? If someone had to define what a stroke is, what is it? So
a stroke is a sudden disruption of blood flow that occurs in the brain. And that's a point that I think is really important. It's something happening inside the skull, in the head. I have a lot of individuals I talk to sometimes think a stroke is something from the heart, in the chest, or something in the lungs or other parts of the body. It's actually in the head, and there are blood vessels that are coursing all throughout inside the skull, almost like roots of a tree. And when one of those blood vessels becomes clogged by something, it could be a clot, for example, that goes up the neck into the head, and when one of those blood vessels becomes clogged, it blocks the blood flow to that part of the brain. That part of the brain then can no longer do its function, and that's what we call a stroke. So what are the signs? You know, we've heard all kinds of initials and little clues. What is the thing we should look for, and what's the easiest way to remember that? So what we always like to talk about when trying to remember the signs of stroke is a tool or an acronym called BFAST, and that's B-E-F-A-S-T. Each of these letters stands for one of the primary signs that someone is having a stroke. Okay, tell us. And the B stands for balance, which could be a sudden loss of balance. The E stands for eyes, a sudden loss of vision or a sudden blurriness of vision. The F stands for face, which is a sudden drooping of the face or weakness of the face. The A stands for arm, which is a sudden weakness of the arm or the hand too. And the S stands for speech, which is the sudden slurring of speech or the sudden inability to speak. Now the T is a special one at the end, which stands for actually time. And the T is to remind us that stroke is an absolute highest level emergency that needs the quickest treatment possible. So the person should dial 911 if any of these symptoms are happening.
Okay. Who's more susceptible to having a stroke?
That's a great question. We know that there are certain elements that we call risk factors, which increase people's risk for stroke. To some degree, anyone could have a stroke. And the reason I say that is that the main risk factor for stroke is age. So as we all get older as human beings, the risk of having something like a stroke does go up. It doesn't mean that someone that's older will have a stroke or should. It just means that that chance does get higher. That's for everybody. Now, in addition, though, we do have identified risk factors that we call the modifiable risk factors. We can't change our age, unfortunately, maybe one day, but there are things that we can change. And these are strong increases in the risk of having a stroke.
What are they?
So high blood pressure, which is also referred to as hypertension, is probably the main one.
Okay.
High blood pressure, especially as we get older, especially above the age of 50, but really at any age, really strongly increases the risk of stroke. The other one is diabetes. So diabetes now I should point out, it's really diabetes that's not well controlled. So really high blood sugar levels that aren't well controlled, that also increases the risk of stroke. The next one is high cholesterol. So those are the fatty particles that are in our blood that the doctors can measure by doing a blood test. It's a very simple test. When those are elevated, that increases the risk of stroke. The other main ones are really smoking. Tobacco use is well established at this stage to directly increase the risk of stroke. And also generally what we refer to as really not having a healthy lifestyle. And that's a big concept because healthy lifestyle involves all sorts of things from diet, nutrition, exercise, sleep. And so, really not having that healthy lifestyle does increase the risk of stroke.
So if you had to give one piece of advice to someone about trying to ward off a stroke, or if they're with someone and they see those symptoms, what would you tell them?
My advice would be to focus on these modifiable risk factors, which is check your blood pressure. Go to the doctor and have them check your blood sugar levels and your lipid levels, which is the fat levels in the blood. And really strive to really live the healthiest lifestyle that an individual can. Because it will allow the person to feel better. They'll feel better if they're exercising. They'll feel better if they lose weight. They'll feel better if they are not smoking cigarettes. But it also dramatically decreases the risk of having something tragic like a stroke happen.
And we're not talking about going out there and trying to qualify for the Olympics. We're talking about just moving, walking, maybe eating fresher things. Little changes can make a big difference, is what I'm hearing.
Little changes make huge differences. Imagine a pebble in a pond and you see the ripples going out. Even getting out every other day for a 30 to 45-minute walk can have a dramatic increase or benefit on decreasing the risk of stroke. And you're exactly right. It's really, more about thinking about progress and just taking little steps
Just do something.
rather than perfection. Yeah.
Okay, thank you for that education. And remember, be fast. Thank you, Dr. Rosado.
Thank you so much for having me.
We'll be back right after this. We are continuing our important conversation about stroke. Joining us now is CJ Curran from the Orlando Health Stroke Support Group. CJ plays a key role in supporting stroke survivors and their families, helping them navigate recovery and regain quality of life. Now, today we'll discuss the vital resources available for stroke patients, the emotional and physical recovery process, and how the Stroke Support Group is making a difference. CJ, thanks for being with us.
Thank you for having me.
Now, we're going to start out by saying you are a physical therapist.
Yes.
So in a nutshell, how would you define that?
Yeah. I think a lot of people's exposure to physical therapy is oftentimes more of the orthopedic side of things, low back pain, a sports injury, post-surgical, whereas what we do is a smaller facet where we are neurologic physical therapists. So our priorities, our strategies are a little different than just focusing on hurt muscles or hurt joints. So there's a lot of times where our side of physical therapy is a little bit more unfamiliar, but that's a good thing. We don't want people to be as exposed to our side of physical therapy, but we do deviate a little bit from what people's typical exposure to physical therapy might be like.
Now, you have a really narrow niche in dealing with stroke patients. What are some of the most common things that you encounter?
Yeah, when you're dealing with an injury to the brain, it's the most complex thing in the human body. So how it can affect someone can be quite different from one person to the other. It might be more upper extremity challenges or lower extremity or speech and cognition, sometimes all of the above. So it does require a full team to kind of tackle those issues. And that team typically looks like a PT, an occupational therapist, and a speech and language pathologist.
Occupational therapy, how is that different?
So a lot of times when we kind of divvy up the responsibilities, to make it simple, the PT looks at the feet and the legs, and the OT looks at the arm.
Okay.
But that might be oversimplifying it, but that's kind of how we explain it to patients.
The stroke support group, that sounds like going a little above and beyond. How did you get involved in that?
Yeah, so as a physical therapist, I'm not a mental health professional. I don't pretend to be, and I make that very clear to everyone there. But the support group was designed to fill a need in the community that we felt like was present. I would love to take credit for the idea, but it was not my child. It was I was kind of bestowed upon me to take it to the next stage. But we do try to fill that need, and we do try to provide that support.
Are we talking about things like emotional support, helping the family figure out what the new normal is?
Yes.
Talk a little bit about that.
Yeah, so what a lot of people have come to realize, when you break a bone, a lot of times you're the only person that feels that pain and goes through that process. But there are certain diagnoses, stroke being one of them, where everyone goes through it. Obviously there is the survivor themselves, but the reaches of its impact is a little bit more than just the patient.
So tell me what you do for the supporters of the patient.
For sure. So our community, our group is open to not just survivors, but to the caregivers themselves. And the support component of the group is from each other. From the victims, from the survivors, from the caregivers. Like I said, I'm not the mental health expert there. It's so easy for us as the therapist to say one thing and we get to stand up and walk away, whereas they're the ones going through it. So there's a lot of things that only other survivors can relate to each other about. And that's what we try to create, an environment where they can gather, they can support each other, they can answer questions or just hear each other out with whatever struggles they might be going through, whatever resources that they might have tapped into that others might maybe not have yet.
What do those resources look like?
So a lot of times it might be community resources. We have folks in the support group that might be 2 weeks post-stroke and others that are 2 years post-stroke. So they've gone through certain challenges or hurdles that maybe someone who's a little bit more fresh in the recovery process have not gone through. Sometimes they have advice on dealing with Medicare or advice on dealing with other community avenues, even things that might be available in their own counties from like a transportation standpoint and stuff like that. So they get to kind of bounce ideas off each other and how they solve certain day-to-day dilemmas.
And kind of spread the bearing of the stress.
Exactly.
By knowing they're not alone.
They're not alone, yeah.
Okay.
Yep.
Success story. Do you have a couple of favorites?
Yeah. One of the beauties about working with stroke, and that's why so many people love working with, is that people get better. The research does show that about 80% of individuals are able to walk again after 6 months of having a stroke, which is oftentimes the number one goal for folks. So we are surrounded by success, which is why we love to be a part of that story. But obviously there's people that stand out. And so many times when people think of stroke, they do think of maybe a little bit older demographic, which is supported by the research, but it's not always the case. And I do have a patient that is near and dear to my heart that was She had just had a successful delivery and then had a stroke on the delivery table. And it was a heavy duty stroke. It was all hands on deck. She was nonverbal. She struggled walking, and I was fortunate enough to play a small role in that process, but obviously she kind of took hold of her own recovery as well. It wasn't just us. And she's years post now, and I ran into her at our recent stroke reunion, and she walked in with her children and shared her story with her own words, and she was heard loud and clear. So she's made quite the recovery.
And I can tell by the look on your face, this part of your work really brings you a lot of joy.
No doubt about it. I mean, this is kind of why we get into it.
One piece of advice for the support system around a stroke patient. What would you tell people?
I think it's important for clinicians as well as the community to know that as we learn more about this diagnosis, there are things that, whether you are educated in healthcare or you're not, when someone has a stroke, you might be able to see the effects, the weak arms, maybe hear the slurred speech or see the imbalance, but then there's a whole nother side of recovery that we can't see. And we all have mental health challenges, but especially after a diagnosis that can be as devastating as this, there's changes in people's roles as parents, as husband and wife, as workers, and that can really take a toll on someone's emotional side of things. So we are learning more and more that these individuals are very susceptible, especially as they go longer and longer through the process of experiencing social isolation, of experiencing loneliness, depression, and unfortunately, as that ball, it can roll out of control and have effects on the actual physical side of things, on people's motivation, on their recovery. So I think the big take-home message for individuals is for them to know that they're not alone, that there are resources out there for them.
That's a great
and that
place.
we're trying to fill that void, and we're not perfect at it, but we're doing the best we can to try to be a mainstay in the community.
For what you are doing, that it really is work of the heart.
Yeah.
Thank you, CJ.
No problem.
We'll be right back. Although strokes are the leading cause of adult disability, it doesn't have to sideline your life. As we heard today, time is your biggest asset, so use it wisely and continue to make healthy connections. I'm Annetta Wilson. Thanks for joining us.